So you've planned and launched your content marketing campaign. Now what? I'll tell you more when we return. Colin here, and welcome to the final day of our look at dental content marketing. For the last few days, we've looked at why and how using content to market your dental practice can be hugely effective for your new patient flow. We've talked about how to promote that content so that more people see it. So what's left? Well, for some dentists, nothing. They would put in all that work, send their content into the world, and then just expect the patients to come rolling in. But the few, the ones savvy enough to watch this podcast, know that you have to track and revise. So how did dentists know whether the content marketing campaign worked? Well, let's go back to the first podcast in this series, Monday's podcast. What were your goals? What is it to generate more and better leads, more and better patients? I mean, it's pretty easy to track with web forms and tracking phone numbers. What about to generate new appointments and new patients and revenue? Same thing. It's pretty easy to cross-reference who signed up to get your content with those new patient exams. Did it generate brand recognition for you? Well, it's a little bit harder to track, and frankly, that's a little bit of a mushy metric. That might require some look at softer numbers like website visits, fan pages, blog comments. But most importantly, look at your ROI. How much did you put into the campaign in terms of hours and dollars? What did that cost you? Now compare that with how many new appointments and leads you generated. Focus on the metrics that matter. Phone calls, new appointments, dollars in your pocket. What's a new patient worth to your dental practice? It'll be clear whether the number of new leads and the total patients and how it relates to the cost of the campaign once you look at it. Now, of course, content marketing doesn't end until you pull the content. Your content's going to continue to do its job out there on the internet for as long as you make it available. So make sure you look at the results over time and evaluate its success. SEO is a marathon, not a sprint. Finally, and this is going to sound so simple, find what works and keep doing it. Find what doesn't work and stop doing it. I hope you've enjoyed this look at content marketing. If you're ready to discover what our clients know about attracting patients online that maybe you don't, schedule a patient attraction blueprint session with me. These are free to any serious dentist who wants to see what a patient attraction system that can double their practice would look like. For more information, go to smartboxwebmarketing.com/blueprint. Until tomorrow, keep moving forward.